Chronic anxiety. What you've been told causes it is absolutely wrong. Today on Dr. Osborne's Zone, we're going to dive into why anxiety happens, what you can do about it, and how to navigate this very life-altering situation. Stay tuned, we'll be right back. You unlock this door with the key of compassion. Beyond it is another world, a world of science, a world of common sense, a world of sanity. You're moving into a land of both empathy and ethics, of nutritional knowledge and empowerment. You've just crossed over into Dr. Osborne's Zone. Anxiety, so many suffer from it, but the solutions are awful. You know, what happens typically when you get a diagnosis of anxiety? Your doctor pulls out the prescription pad, begins to write SSRIs or anti-anxiety medications for you without any real solution as to why the anxiety exists in the first place. Now, there are a lot of causes for anxiety, and we're going to dive into those causes tonight. Some of them may surprise you. Certain nutrient deficiencies, certain behaviors can actually drive this process, and research is showing more and more that if you don't address these things, taking medicines won't be as effective in the long run for you and could have additional consequences from their side effects. So let's dive in to what's driving your anxiety. So first, let's start here with kind of just giving you a general diagnosis of the terminology here. You can see here, anxiety disorder is characterized by excessive fear or avoidance of perceived threats that can be persistent and debilitating. Key word here is perceived. So like one man's anxiety is not another person's anxiety, right? So the perception of threats. And you know, we just got through a few years of a lot of perceived threats, right? So I'm sure many of you can relate. And we haven't had higher anxieties, I don't think, in our history than what we've had in this post-COVID world. Diet is a modifiable risk factor that may contribute to the pathogenesis or treatment of anxiety, depending on diet quality. Although the biological mechanisms by which food-specific nutrients and nutraceuticals impact mental health are not completely understood, implicated pathways include inflammation. We've talked about this a number of times. Brainflammation. I've talked about how gluten induces brain inflammation that can drive psychiatric disorders. We're going to talk a little bit about that today, but inflammation is an underlying process. Oxidative stress. So those of you that smoke, those of you that drink excessive alcohol and are getting exposure to that oxidative stress from those types of things and other chemicals. And then we have brain plasticity effects, mitochondrial dysfunction, neurotransmitter metabolism, etc. Essential dietary trace minerals, such as zinc, copper, iron, and selenium are critical components for numerous biological proteins and may have a role in these proposed mechanisms related to brain health and anxiety. And so this review study analyzes those things. I'm going to dive into that in a minute, but I want to give you kind of in summary what the current research has identified, and that is deficiencies in zinc, iron, and selenium are associated with anxiety, while copper overload may impact anxiety to a greater degree than copper deficiency. So again, iron, zinc, and selenium deficiencies are associated with increases in anxiety. So let's define anxiety to begin with, right? So anxiety disorder is characterized by excessive fear or avoidance of perceived threats that can be persistent and debilitating. So perceived threats, how many of us have gone through this, especially over the past 3 to 4 years, that COVID era where there was so much going on. There was threats of your business closing, there were threats of an illness, there were threats of having to be forced medical procedures, be forced on you to lose your job. There were all kinds of people having all kinds of perceived threats, and anxiety has really never been at a higher point, I don't think, than it is today. But again, that's the definition of anxiety. Now let's dive into some of the other, or some of the things rather, that can cause or contribute to anxiety. Now these are chemical factors that can contribute to anxiety. And we're going to break this down. We're going to talk about chemical, physical, and emotional factors. We're going to start with chemical factors here. So chemical, when I say chemical, this is anything that can come into your body, whether voluntary or involuntary, that can have a chemical impact on your biochemistry, but you can't physically see it happening per se. And so like gluten is a perfect classic example of something that we know can drive anxiety through the inflammatory cascade and through the antibody, the immune system cascade of creating disruption in your neurochemistry. We know that processed foods can drive anxiety. We know that sugar, a lot of the earlier research studies on sugar in prisons and sugar in schools showed that when you took these things out of prisons and schools and gave organic food, non-processed food, you actually improved behavior and reduced aggression and anxiety. We know that alcohol can drive anxiety. One of the biggest reasons alcohol plays such a big role in anxiety has to do with the fact that it causes nutritional loss. And we'll dive into this a little bit deeper in just a minute, but alcohol actually causes vitamin and mineral deficiencies, many of which have been linked to increased risk for the development of anxiety. We know that energy drinks, which fall under the same kind of category as stimulants, right? We got that caffeine overload. How many people do you know today that, for the sake of studying better, how many college students do you know that have been put on Adderall so they can study better because they can't focus or concentrate? Well, all these different stimulants that are super common in today's day and age, they drive up catecholamines, which are adrenaline and noradrenaline. And again, too much of these, if you've ever had a bout of adrenaline bursting because you were super stressed out, you got super anxious, because catecholamines drive anxiety. So these energy drinks, the abundance of caffeine and Adderall and other drugs that are being used as study aids and for ADHD and things of that nature, drive up these neurochemicals that can drive up anxiety. We also know that antibiotics can play a role. There's a number of research studies now showing that antibiotics disrupt the microbiome. These are the healthy bacteria that live inside of your GI tract. Many of these bacteria are responsible for the production of dopamine and serotonin. And so when you're wiping out this microbiome on a regular basis to treat urinary tract infections, upper respiratory infections, etc., you can have a major impact on your neurochemistry in your brain through dopamine and serotonin reduction. Let me take that S out of there. That should be an N. We also know things like chlorine exposure, fluoride exposure, pesticides. So these are actually forms of pesticides. Fluoride and chlorine are oftentimes used to make pesticides because of their antibiotic effects. So these things are commonly found in our drinking water, right? Most municipal water agencies add chlorine and fluoride to the water. So you're getting exposure to these in a big way if you're not drinking purified water. So it's very important that you filter your water to remove chlorine, to remove the fluoride. You don't want that nonsense in there. Those can drive this process as well. Pesticides, beyond the chlorine and the fluoride in the water, you also get these in your food, right? And this is typically in processed food, but you can also get it in non-conventional produce as well. So buying organic becomes a very important factor in helping to reduce the risk for developing anxiety. We've also got things like heavy metals. I don't know if you saw in the news recently, there was a big expose on a particular company's applesauce being lead contaminated. Now, lead will displace magnesium and zinc and calcium. So lead toxicity can cause the body to behave as if it's deficient in these three minerals. And as we'll talk about shortly, these minerals play a role in anxiety as well. So heavy metal exposure, not just through applesauce, but we can get heavy metals through our water. A lot of times we get heavy metal exposure through dental amalgams or through other types of foods. Other studies have recently come out on chocolate. Sorry, ladies. Chocolate having lead contamination as well. Of course, we've talked historically about rice containing lead and cadmium and arsenic as heavy metals. So heavy metals are a part of our modern society. And again, it's very important that in order to reduce your exposure filter your air, filter your water, and try to eat whole organic food, and you will go a long way to reducing your exposure to heavy metals. And then we've got food additives. And so predominantly the FD&C dyes, FD&C stands for food, drug, and cosmetic. These dyes are commonly used in cereal and candy and toothpaste and mouthwash and in medications and in cosmetics, etc. And these dyes, thanks to several great doctors who came before me, were shown to cause aggressive and anxious-like behavior in adolescents and in children. And so we know these food additive dyes can play a major role in the development of anxiety. So avoid them. Very simple. Read your food labels. Anything you can't pronounce, anything you can't say without a biochemistry degree with ease, then is probably better left as not food or not something you put in your body. Now let's talk about some of the minerals and their linkage and association with anxiety. Now this was a major research paper published on trace minerals and anxiety, a review of zinc, copper, iron, and selenium. This was just recently published in Dietetics. And so what you can see here, I'm just showing you some key points and takeaways from this research review. So here is a summary in this table 1, a summary of the nutrients, rather the summary of zinc and its relationship in human studies to anxiety. And so you can see all of these studies here are human studies. These are not animal studies. And so you can see female high school students, female university students, adult Japanese workers, children and adolescents with ADHD, male Chinese individuals, adults from Bangladesh, patients with type 2 diabetes and coronary heart disease, and this one Iranian females, and this one Guatemalan school-aged children, and this one patients with anxiety, and this one patients with anxiety and depression, and this down on the bottom, and individuals with anxiety. So my point is, this is a pretty good array of young people, elderly people, middle-aged people, but it's all people. And if you look at the key results here in the center, it's pretty much the same thing. Everything you see highlighted here in blue, inverse association between serum zinc levels and anxiety, meaning the lower the person's zinc levels in their blood were, the greater likelihood of anxiety in the actual patients. And so you can see the same in each of these studies. Low serum zinc correlates with higher anxiety and conduct issues. This was the one done in children and adolescents. We can see in this study, cerebrospinal fluid zinc was negatively correlated with anxiety symptoms. We see here participants with anxiety had low serum concentrations of zinc. In this study, zinc sulfate and magnesium oxide supplementation reduced anxiety symptoms. In this study, zinc supplementation reduced anxiety and other symptoms related to premenstrual syndrome. One of the classifications, ladies, of PMS is called PMS-A. The A stands for anxiety. Of course, the PMS stands for premenstrual syndrome. And so zinc supplementation and zinc deficiency linked to that anxiety aspect of menstruation. We also see in this one, increased serum zinc was associated with reduced anxiety symptoms. And in this study here, patients with anxiety had lower serum zinc concentrations compared to control. Anxiety symptoms were reduced after zinc and antioxidant supplementation. Remember what we said in the beginning, that there are mechanisms we suspect are driving anxiety. One of them is inflammation, and one of them is oxidation. This is where antioxidants come in. Antioxidants fight oxidation. There we go. And then you can see here in this study, zinc and antioxidant treatment reduced anxiety and normalized plasma zinc. So again, that antioxidant component. In this last study, individuals with anxiety had lower levels of serum HGF and zinc compared to control. 8-week zinc, again, antioxidant supplement, correlated with increased serum HGF. So lots of research that has been published directly linking zinc deficiency to anxiety. Now let's look at selenium. So we can see here in this, again, review paper, we got several studies here. We got Portuguese adults with chronic renal failure. We've got Chinese children. We've got women age 18 to 40 with PCOS. We've got adults 45 to 85 diagnosed with type 2 diabetes and congestive heart disease or coronary heart disease, and we got females from 14 to 74, and we got healthy men from 18 to 45. Nice array of different folks, different races, genders, etc. And what we've got over here, key results: higher anxiety was associated with selenium deficiency, lower serum selenium associated with higher anxiety. Selenium in a probiotic, remember what we said earlier about antibiotics creating an increased risk for the development of anxiety? This is part of that. So selenium in a probiotic treatment was associated with reduced anxiety symptoms. And in this study, same thing. Selenium probiotic treatment was associated with improved Beck anxiety inventory scores. The Beck anxiety inventory is a test that patients are given to measure their anxiety. And then we have selenium supplementation associated with decreased anxious mood in this study. And then high selenium diet was associated with improved anxiety scores in that final study in men. So selenium, pretty good research in humans showing benefits. Then we get to iron. So these are research studies about iron deficiency. And so you can see here, again, a nice array of different people. We've got children in infancy and adolescence. We've got children with children and adolescents in this study. We've got females in this study, adults in this study, et cetera, et cetera. But coming over here to results, greater self-reported anxiety symptoms during adolescence for participants with iron deficiency as an infant. We also have IDA. This IDA stands for iron deficiency anemia. IDA correlated with an increased risk for anxiety disorder. You know, I wanted to stop and make a point on iron, since we're talking about iron deficiency anemia, and we'll get back to this. But one of, and this is particularly important for females who are of the age where they're menstruating. Because what happens, this is scheduled blood loss, right? I mean, it happens every month, every 28 days on a schedule. And what is in your blood? Lots of nutrients are in your blood. When you lose blood, you're losing nutrition. You're not just losing iron, you're also losing selenium, you're losing zinc, you're losing a lot of nutrients. But one of the big ones is iron. And so with that blood loss comes the loss of iron. And so what happens a lot of times to females is we have this transient iron deficiency anemia, and that can translate into anxiety and aggression in females around their cycles. And so how many of you have ever experienced an increase during your cycle of anxiety or an increase in irritability or aggressive behavior? And so this is important to recognize. It's very important for you to recognize for your husband's sake, right? Because a lot of times women are very emotional during this time frame, and it's not their fault per se. But if you knew this, right? If you knew you could get more iron in you, you could supplementally take iron or eat more foods rich in iron before this happens, you could buffer some of that iron loss and potentially go through your cycle with less of these types of symptoms, making you much more happy, making the men in your life much more happy as well. So don't take this as an insult or a sexist comment. What I'm really after here is educating you so that you can take a preemptive step before your menstrual cycle. I like to, when people come to see me, when women come to see me and they have this kind of transient iron anemia that comes frequently, what we do is we put them on iron supplementation a week before their cycle and the week of their cycle. And in this way we can keep their iron levels from hitting that dip, driving up that anxiety as a symptom. So back to our research study, patients with iron deficiency anemia had higher levels of anxiety compared to the control group. Positive association between symptom-based iron deficiency anemia and anxiety for females, but not for males. Again, why females but not for males? Part of it has to do with males don't typically have blood loss, especially in today's world where they're not out doing physical jobs and physical labor to the extent they used to. So there's no risk for that blood loss, for those cuts and scrapes and other things associated with physical work. And we have low dietary iron was associated with poor sleep quality and poor sleep was associated with higher anxiety. So what they're saying here is low iron equals bad sleep, which leads to more anxiety. And that makes sense. Then we have this iron supplement improving anxiety symptoms in this research study in patients with inflammatory bowel disease. And we have iron supplementation reducing anxiety and increased key iron-related proteins like hemoglobin, ferritin, and transferrin in these pregnant women from Italy. And then here, iron status inversely associated with stress and anxiety, and iron supplementation improved stress scores. And then the last one here, anxiety scores improved and serum iron was increased after the treatment. So, no small body of evidence on this topic. Now let's talk a little bit too. I wanted to bring some more micronutrients up. So let's look at vitamin B12. So shifting a little bit away from the minerals from that review study, and specifically focusing on vitamin B12, the neuropsychiatric manifestations of vitamin B12 deficiency, what you see here in the abstract. Vitamin B12 deficiency can have distressing neuropsychiatric symptoms. It can have an etiological role in clinical presentations like depression, here's what we're after, anxiety, psychosis, dementia. So any of those of you, what do we see in women a lot? I'm not trying to pick on women, but I see this clinically in women a lot more than I do in men. So I'm just sharing my experience with you. But women have a higher level of anxiety, and they also have a higher level of reported brain fog and brain fatigue, right? And this, again, going back to what we were talking about, iron loss through the menstrual cycle, but also B12 loss as well through that blood loss. So we've got B12 deficiency can manifest as anxiety. Now, I've seen this happen so many times where we have someone who's come to me and they've been to psychiatrists, they've been to their family doctor, they've been to a number of doctors, and they've been basically rubber stamped with an anxiety diagnosis. And, they've been put on drugs to treat the anxiety. And that's, maybe that's helpful in some ways, but how many of you have ever had the diagnosis of anxiety and your doctor gave you a drug but did not proceed to share this information with you? So let's look at, formally, these are the symptoms of iron deficiency, B12, and anxiety. You can see the check marks here. So anxiety checks off all the boxes, but look at B12 deficiency, right? Shortness of breath, extreme fatigue, hair loss, depression. Then we have iron deficiency, same kinds of things, shortness of breath, extreme fatigue, hair loss, irritability, the same kinds of symptoms that we might see manifest or progress in people that struggle with anxiety. So my question to you is, if you've been diagnosed with anxiety, do you really have this inherent genetic problem where you're just anxious? Because there are some people, we call them type A's, type A personality, that have a tendency to be more anxious. Are you that? Or do you actually have a micronutrient deficiency that's driving the anxiety forward, that's exacerbating it or making a pre-existing genetic predisposition much more prolific in your life? And so what I would encourage you to do is, if you've ever had this diagnosis, ask your doctor, it's a very simple blood test, to do an iron panel. Ask your doctor to check your vitamin B12 levels, as well as these other nutrients that we've talked about today. Now, let's dive into some more nutrition anxiety relationships. So, over here on this side of the screen, you can see, does magnesium supplementation decrease anxiety in adults? This was published in Evidence-Based Medicine. You can see magnesium supplementation may reduce anxiety in adults with chronic, mild to moderate anxiety. You can see here magnesium supplementation may also reduce anxiety in adults with chronic severe anxiety. Then we have this study down here on magnesium as well. Magnesium deficiency induces anxiety, so the deficiency induces the anxiety. Preclinical and some clinical studies suggest a relationship between perturbation in magnesium homeostasis and pathological anxiety. In other words, if you have low magnesium status, there's a greater risk of the developing of anxiety. Although the underlying mechanism remains largely unknown, since there is evidence that magnesium modulates the HPA, the hypothalamic pituitary adrenal axis. In other words, these researchers are testing the theory of whether or not magnesium's role in the HPA axis, that's your adrenals and your pituitary axis. What they found, overall, the present findings demonstrate the robustness and validity of the magnesium deficiency model, and this was done in mice, as a mouse model of enhanced anxiety, showing sensitivity to treatment with anxiolytics and antidepressants. It is further suggested that dysregulations in the HPA axis may contribute to the hyperemotionality in response to dietary-induced hypomagnesemia. So in these studies, they're inducing low magnesium levels to measure whether or not the HPA axis was dysregulated, and what they found that yes, it was. In essence, magnesium, because of its role in regulating your hormones, can play a role when deficient in contributing to and driving anxiety up. Now, what else do we know about magnesium? It's Mother Nature's muscle relaxer. Now, a lot of doctors prescribe different types of drugs, including muscle relaxers, for people who have high levels of anxiety. Anxiety, for a lot of people, a lot of times will manifest in the muscles as tightness. Again, going back to what I said earlier, those catecholamines like adrenaline and noradrenaline will make your muscles really tight, really stiff. That can cause a lot of tension. And what does magnesium help to do? It helps to relax the muscles. So what kind of quantities are we talking about for magnesium in this way? Well, some studies show that as little as 200 milligrams of magnesium can be helpful. So, if we're looking at safe ranges that anyone can use, it's 200 to 600 milligrams per day, divided doses of magnesium as a very safe range to stay in. Generally, if you're going to go too much over 600, it might not be a bad idea to work with a doctor or get your levels checked. But magnesium can definitely play a role, and there's definitely association with magnesium deficiency and anxiety. What about vitamin B1 thiamine? So you could see this was a study done on the impact of thiamine treatment for generalized anxiety disorder. Though it was a small study, there weren't a lot of participants in this study, the results were still quite profound. Thiamine supplementation significantly improved HARS scores. That's the Hamilton Anxiety Rating Scale. So this is, again, a particular way we measure anxiety. Increased both appetite and general well-being, and reduced fatigue in patients with generalized anxiety disorder. Now, this last statement I find more than interesting. I find it quite appalling, and that is, interestingly, these patients were able to discontinue taking anxiolytic and beta blocker medications. Now think about that for a second. How powerful is that? You have patients that have a generalized anxiety disorder diagnosis. They're being medicated for it. They put them on vitamin B1, and now they're able to get off their medications and still feel better. So again, is anxiety a true disorder, or is anxiety a nutritional problem? My advice to you is, if you don't know why you were diagnosed, you better get your nutrition checked. There's so much evidence that nutrition plays a role in this, and if you're not looking at it, you could be missing something very key and important in your longevity and your health. Now let's look too at some other B vitamins. So this was published, this was a review study published. You can see the role of vitamins and minerals in psychiatry. And so you can see here, look at the introduction. I love this first statement. Roughly 90 years of research demonstrate the relevance of dietary nutrients for mental health. 90 years. This is not new information that I'm presenting to you. 90 years of data. Some of the earliest research studies on nutrients relevant to mental illness observed irritability and mood problems in people known to be deficient in the B vitamins. as well as reported positive improvements in mental illness when treated with such nutrients as manganese. So manganese being a mineral. So going back to, we already talked about zinc and iron. We talked about copper a little bit. We talked about magnesium, etc. And nicotinic acid. So nicotinic acid is also B vitamin. It's actually vitamin B3 or niacin. And so, regardless of whether or not the patients could be found to be deficient, so in other words, treating patients with these nutrients led to improvements even if these patients weren't found to be deficient, meaning there's a therapeutic role for these nutrients to play. Although interest in such studies have declined since the introduction, go figure, right? Since the introduction of psychiatric medications in the 1950s, all of a sudden the interest in nutritional research started to decline. Now, why do you think that is? Do we have a body of evidence that shows there's very tremendous impacts and effects on people's mental health disorders using vitamins and minerals? Very safe, very low risk, no side effects, not expensive. But then in the 1950s, here comes the psychiatric meds. Super dangerous, super profitable, patentable. So what do you think is going to happen to the prior research? It's going to get discouraged, right? Because it's not profitizing. It's not something that's going to make people a lot of money. And so we saw the entire medical profession navigate away from therapies that worked in lieu of therapies that were profitable. Now, say what you want. You can accuse me of being an anti-medical establishment person, but I'm not. I'm a truth person, and I want you to know, because a lot of people don't recognize the importance of the brain and the mouth. What you eat, what nutrients you put in is going to affect how you think, and this could never be more important than it is today. Look at society. We've got school shootings, we've got people road raging, we've got people angry at other people for a variety of different reasons because of differing opinions. And so never have I seen more segregation and hate and anger in the world than I've seen post-COVID. And if we're not going to have a conversation about nutrition and the mind and psychiatry, we need to have this conversation in a bigger way, because the psych meds have had 70 years to change it, and they haven't. Problems are getting worse, not better. We've got to turn back time, and we've got to start looking at these micronutrient connections. So you see here going on. Recent work on folate or vitamin B9 suggests that low levels may be associated with depressive symptomatology and poor response to antidepressant medications. I found that interesting too. In other words, if you were on an antidepressant medication and not responding well, you would respond, and research has shown this, you will respond better if you take folate. So do you need the antidepressant medication, or do you just need more folate? That would be an interesting study for somebody to do. I don't believe that one's been done yet. Going down the list here, thiamine, vitamin B1. For anxiety, thiamine has been used successfully at doses, so here's your takeaway, doses of 250 milligrams a day to treat patients with anxiety disorders, including symptoms manifesting as chronic fatigue, insomnia, nightmares, anorexia, nausea, and vomiting, diarrhea or constipation, chest and abdominal pain, depression, aggression, headache, diaphoresis or excessive sweating, and fevers of unknown origin. Among over 200 subjects, successful responders had deficiency or deficient RBC transketolase. You've heard me talk about this before. Transketolase coactivity or co-efficient activities, or TKCA. It's a type of test. It's a rare test. There might be one lab still in the US that will perform transketolase activity coefficient testing. But what they were finding is that those that were good at responding to thiamine dosing, they found low RBC transketolase in 73%, and that when supplemented, those were normalized. In other words, this is just a marker for vitamin B1 deficiency that can be measured. So you could potentially ask your doctor to do it, although they may not have the ability. I like to use what's called intracellular testing to detect vitamin B1 deficiencies. It's also very helpful. But let's go to this last sentence here. So again, let me reread that to you. So Among 200 subjects, successful responders had deficient RBC transketolase, which normalized in 73%. So again, it corrected 73% of these people's vitamin B1 deficiencies is based on that particular lab test. And subjects and led to disappearance of great clinical improvement in most of the symptoms. So powerful. Like, this is powerful medicine, folks, that's being dismissed as quackery because it's nutrition. And then we get down here to vitamin B6. And you see B6 and folate have been used successfully for depression. And then we have inositol, is unofficially a B vitamin that is found in cell membranes where it functions closely with choline. We've got crash courses on both of those. Inositol was equivalent to single drug therapy for depression and panic disorder in one study and is a potential antidepressant. One study found 75% of depressed patients to be magnesium deficient, with another 99% at borderline levels. Magnesium supplementation was helpful. So we've got inositol, we've got vitamin B6, we've got magnesium, we've got choline. And inositol was equivalent to single drug therapy. How many of you have ever been to a psychiatrist where they pulled out the prescription pad and said, here you go, I want you to take inositol, instead of putting you on a potentially very dangerous drug with a lot of side effects? A lot of these antipsychotic and a lot of these anti-anxiolytic medications cause B vitamin deficiencies. That's one of the other conundrums, is the very drugs used to treat anxiety can actually deplete your B vitamins, deplete your magnesium. So let's look at some of these other studies here on just using micronutrients. So in this one, it's an interesting study. They were looking at, because they were studying kids with attention deficit hyperactivity disorder, and during the middle of the study there was an earthquake. So they were actually it allowed them to use the earthquake as a major event that would cause anxiety, to see which of these people did better handling the anxiety, because they were doing an ADHD study using micronutrients to look at outcomes in ADHD. So here's what they found. Okay, let's just read it here. The role of good nutrition for resilience in the face of stress is a topic of interest but difficult to study. A 7.1 Richter scale earthquake took place in the midst of research on a micronutrient treatment for attention deficit hyperactivity disorder, providing a unique opportunity to examine whether individuals with ADHD taking micronutrients demonstrated more emotional resilience post-earthquake than individuals with ADHD not taking micronutrients. 33 adults with ADHD were assessed twice following the earthquake using a measure of depression, anxiety, and stress, also completed at some point pre-earthquake. 17 were not taking micronutrients at the time of the earthquake, and 16 were. And at 2 weeks post-earthquake, what they found is that the micronutrient group reported significantly less anxiety and less stress than the ones not taking micronutrients. So, the bottom line is nutrients are important for your mental health. They're important for your resiliency and your ability to adapt and cope with stress. Now, if we look at this other review study on just broad spectrum micronutrient formulas for the treatment of symptoms of depression, stress, and or anxiety. This is a systematic review of studies. You can see here this review covered double-blind randomized placebo-controlled trials, testing formulas including at least 4 vitamins or minerals used for the treatment of symptoms of anxiety, stress, or depression in adults not currently taking medications for psychiatric difficulties. 16 studies demonstrated positive effects for symptoms of anxiety, depression, or stress. So again, this was published in 2020. This other one was published in 2011. So there's a pretty large body of evidence on nutrition playing a role in your ability to cope and deal with anxiety, and in some cases, resolution of many of the symptoms of anxiety. Now let's talk a little bit about gluten. I would be remiss if we didn't have a conversation on gluten. Those of you who know me, I am the gluten-free warrior. So a lot of people, this is another one we get. So I've done several videos. One of them I did on something called crazy bread, where people eating bread, it would actually drive them crazy. There are a number of reasons why this happens. Earlier research pointed to the fact that bread was contaminated with a mold called ergot, which had alkaloids in it that would cause schizophrenic-like problems. But it's beyond ergot, because today's bread is not full of mold to the extent that it was years ago. Now what we know is there's actually neurologic and psychiatric manifestations of celiac disease and gluten sensitivity. So let's look at this particular publication here. I'd like to call out Dr. Alessio Fasano was part of this. He's one of the world's leading researchers on celiac disease and gluten sensitivity. But here's what they said about anxiety disorders. Various types of anxiety are associated with gluten intolerance. One study found that celiac disease patients were significantly more likely to have state anxiety when compared to controls, and after 1 year on a gluten-free diet, there was a significant improvement in anxiety symptoms. So, gluten-free diet, reducing anxiety. Who would have ever thought? But that's not it. Let's look at this one. Gluten psychosis, confirmation of a new clinical entity. NCGS, that stands for non-celiac gluten sensitivity, has been related to neuropsychiatric disorders such as autism, schizophrenia, and depression. A singular report of NCGS presenting with hallucinations, remember I said bread madness, so schizophrenia hallucinations, has been described in an adult patient. Here in this research report, we report a pediatric case of psychotic disorder clearly related to non-celiac gluten sensitivity and investigate the cause by a review of literature. The pathogenesis of neuropsychiatric manifestations of gluten sensitivity is unclear. It has been hypothesized that leaky gut allows some gluten peptides, gluten peptides are gluten proteins, to cross the intestinal membrane, it's leaky gut, and then from there hit the blood-brain barrier. So as I interviewed Dr. Fasano one year at a conference, we were there speaking together, and one of the things he said to me is, what happens in the gut's not like Vegas when it's leaking. What happens in the gut should be like Vegas. What happens in the gut should stay in the gut. But with leaky gut, you get a manifestation into the bloodstream, which then can traverse to the brain and other organs and other tissues. So, and this has been researched by a number of reviewers or researchers on the blood-brain barrier leakage as a result of gluten exposure. So this again, so this is one mechanism. Another mechanism is what's known as the endogenous opiate system. So there's a breakdown byproduct of gluten called exorphin. And exorphins behave like morphine. So they can attach to morphine receptors, leading to changes in mood and changes in neurochemistry. You also have that gluten peptides may set up an innate immune response in the brain itself, similar to that described in the gut mucosa. In other words, just like it can cause inflammatory damage through the immune system to the gut lining, the same thing can happen in the brain itself, in the neural tissue. And so causing exposure from neuronal cells of a transglutaminase primarily expressed in the brain. Remember, the enzyme that doctors measure to try to diagnose celiac disease is a transglutaminase enzyme. We see these same enzymes in the brain. We see the same kind of reaction occurring. It's been measured in celiac patients. This present case report confirms that psychosis may be a manifestation of non-celiac gluten sensitivity. And they have a report on a 14-year-old girl. And so here's what happened. She started a gluten-free diet with a complete regression of all symptoms within a week. The adherence to the gluten-free diet was evaluated by a validated questionnaire 1 month after AGA, this is anti-gliadin antibodies, and calprotectin, calprotectin is a chemical that measures inflammation, resulted negative. In other words, she had positive anti-gliadin antibodies and she had positive calprotectin originally, but after being on the diet, these markers normalized, as well as the EEG, which is a measure of brain waves. And ferritin levels also improved. Ferritin levels are a marker for inflammation. She returned to do the same neuropsychiatric specialist that now reported a normal behavior and progressively stopped the medication, the drug that she was taking, olanzapine. without any problem. Her mother finally recalled that she was returned a normal girl 9 months after definitively starting the gluten-free diet. She is still symptom-free. So again, gluten psychosis. Who would have thought that what you eat could make you literally crazy? Then we have this report. This was published in the British Medical Journal, 2007. This was a doctor's commentary. He said, at a course for doctors in nutritional treatment and psychiatry that I attended a year ago in Sydney, at one point made by the staff was that 4% of psychotic cases are due to celiac disease. Now think of the ramifications of that. 4% of psychiatry cases caused as a result of gluten exposure. Those are huge numbers. And so how many people are being treated with drugs that could have diet change? So one, how much money could we save on drug treatment? Because again, where there's socialized medicine, there's your tax dollars go to pay for drug treatments for people who just need to change their diet. How many millions or billions of dollars annually could we save by just properly identifying these psychiatric cases as related to gluten? Well, after hearing this doctor said, immediately I started doing celiac screening of all my patients with a history of psychosis. The very first positive one who had relatively minor bowel discomfort was a 38-year-old lady with a 20-year history of bipolar disorder. So think 20 years of bipolar disorder and numerous admissions. So she was admitted to the hospital for chronic severe depression. A few weeks after starting a gluten-free diet, her depression lifted and she has remained well since. I believe that all patients with psychotic illness should be screened. The thought that thousands of people, I would say more than thousands, 4% is not thousands, it's millions, of people are suffering mental torture when a simple blood test could lead the way to dramatically improving their mental health sounds almost too good to be true, but it is. Not my words, the words of a caring, concerning, and discerning physician treating patients, putting them first instead of pharmaceuticals. And then here we have another case, effects of a gluten-free diet in a teenager presenting with psychosis. You see, might present with psychiatric symptoms that could be severe enough to impair functioning. We're talking about gluten, non-celiac gluten sensitivity. In this case report, 15-year-old girl with no past psychiatric history who presented to the emergency department with anxiety symptoms. Again, what are we talking about here? Anxiety and paranoid delusion. So it was even beyond anxiety. It was also paranoid delusion. That did not improve on conventional treatment. So they tried drugs and that didn't work. However, a significant improvement was observed upon starting on a strict gluten-free diet. This case adds to the existing literature suggesting a possible strong relationship between gluten ingestion and psychiatric disorders. It's not a small group of studies. There's a lot of research now confirming the relationship between gluten and psychiatric disease, including anxiety. Now, we look at a few more here. So how bad can it get? You know, I mentioned earlier school shootings, and I think it's important to bring this up. So, and this was published by the National Post. This was also written up in rounds in the New England Journal of Medicine. And so, as case 14 in 2016, it was a 37-year-old woman with adult onset psychosis. So she's an adult. She develops a severe psychosis. This report is this woman. Okay, so this again, doctors from the New England Journal talked about this woman, but this woman tried to kill her parents after gluten sensitivity induced psychosis. And so again, a lot of people will ridicule these statements. They'll say, oh, diet doesn't make you crazy. There's no way that could be possibly true. I've just spent the last 10 minutes showing you case after case of people who are gluten sensitive developing psychosis. This last one, a woman who literally tried to kill her parents. She is in jail for attempted murder, and this could have been stopped if doctors would learn how to recognize gluten sensitivity as a potential problem in psychiatric disease, including anxiety. So when are we going to wake up? We've had so many school shootings. We've got children that are violent. If we look at today's diet, 50% of calories are wheat. This has never been true in the history of humankind. We eat more of this type of stuff. You know, kids get up in the morning, what do they get? They get cereal, and then usually at lunch they get some kind of pasta or sandwich. And they're basically, this is just wheat. We're not talking about corn, we're not talking about rice, we're not talking about oats, we're not talking about the other grains as well. We got to get this out of the diet, because what we see are kids are suffering with massive levels of anxiety, more than they ever had. And part of the problem is that there are an estimated, and this is an estimated, I think the number's higher, but it's estimated that almost 14% of the population is gluten sensitive. When we talk about gluten sensitivity versus celiac disease, 1% of the population we know has celiac disease, 14% has non-celiac gluten sensitivity. How many of those are suffering with psychiatric problems in our schools? How many of those are maybe the potential reason why kids potentially are pulling the trigger, are losing their minds, right? I'm not trying to blame gluten on the entire problem, but we have to start looking somewhere. And gluten and micronutrient deficiencies, diet and nutrition have to be looked at if we're going to come to some type of meaningful resolution. Here we have late onset symptoms associated with vitamins. So back to vitamins, vitamin B12 deficiency in a patient with celiac disease. So in this case, well, let's just start from the top. Nutritional psychiatry is an emerging field. It's really not. I showed you earlier 90 years of data. It's not really emerging. It's just that they're now starting to wake up to the flaw of medication. You can't just ignore nutrition for 70 years and not pay a consequence. And we're starting to wake up to that. And that's why they're calling this an emerging field. Ranging from dietary strategies to the study of gut microbiota and immune dysregulation and their impact on prevention and treatment of psychiatric disorders. Cobalamin, which is vitamin B12, cobalamin deficiency has been consistently associated with severe neuropsychiatric symptoms, including seizures, peripheral neuropathy, depression, dementia, and psychosis. Schizophrenia-like symptoms may be present due to other conditions. Here is a case of chronic hallucinations and psychosis associated with cobalamin deficiency and celiac disease. And they had a 75-year-old woman was admitted to an acute inpatient unit after presenting with auditory hallucinations, persecutory delusions, thought broadcasting, and insomnia. She described several voices commenting on her actions and occasionally insulting her, as well as thought echo. She attributed these voices to neighbors and started believing they were conspiring against her. Again, gluten sensitivity. Now, how does gluten relate? We've shown you that gluten relates to psychiatric disease through creating antibodies to the brain. But it's not just that. We said generally inflammation has been a target. But one of the other things we know gluten does is it causes damage. Part of that inflammation occurs to the gut, and it occurs to the liver, and it occurs to the pancreas. Now, why is that important? When you damage the gut, you cause malabsorption. Malabsorption leads to vitamin and mineral deficiencies, which is what we've just spent the better half of the last 45 minutes talking about. So when you're eating gluten, maybe gluten doesn't cause psychosis for you, but if it's damaging your gut, it is going to cause vitamin and mineral deficiencies. Many of these nutrient deficiencies can cause or drive anxiety or make anxiety worse. Then we have the liver. We know gluten can damage the liver. Why is that important? Because the liver plays a role in digestion. The liver produces bile. That bile is then secreted into your small intestine by your gallbladder, and it's very critical for the absorption of vitamins A, D, E, and K, as well as omega-3 fatty acids, which play a role in mental health. We know as well your pancreas can be damaged by gluten, and the pancreas produces digestive enzymes that help you break down your food. So we have the liver, the pancreas, the gut can all be damaged by gluten, leading to malabsorption of nutrients. Those very same nutrients can drive or contribute to anxiety and other mental diseases. So we've got to recognize this for what it is. We need to have a better screening process in this country, really globally, for people with gluten sensitivity issues. Now, this isn't new information. As I said there earlier, the researchers say that this is a body of evidence on anxiety and nutrition that's 90 years old. Well, let's look at how old the gluten intervention information is. Researchers first linked gluten to schizophrenia after World War II. So this isn't new either. This is 70 years old. This information has been around for a very long time. It just gets ignored. Why does it get ignored? Doctors don't study nutrition. Look, you can't address health and wellness if you don't understand nutrition. Drugs do not create health and wellness. Drugs treat symptoms of disease without discerning why the disease exists. Look at what this research review has to say. So researchers first linked gluten to schizophrenia after World War II as Nordic populations ended rationing of wheat products. Got to remember, during the war, wheat was rationed. People weren't getting as much of it. In some cases, they weren't getting any of it. Researchers noted a significant correlation between abrupt increases in wheat consumption and first episode psychosis. Now, a lot of you watching constantly try to blame glyphosate on the problems associated with wheat. This is World War II. This is 1948. Glyphosate didn't start getting used really on our crops until the 90s. So this precedes glyphosate by 40 years. We're talking about neuropsychiatric disease induced as a result of wheat exposure being identified in the 1940s. By 1948, case reports emerged describing comorbidity between childhood celiac disease and schizophrenia. This accumulating evidence led to the serial theory, which postulated that some individuals have hyperactive neuronal opioid receptors that uptake excessive amounts of gluten exorphin. I was talking about that earlier. These are proteins. This is significant for schizophrenia because exorphins affect dopaminergic signaling in mechanisms not completely understood. Researchers postulate that excess gluten exorphin uptake could disrupt brain dopaminergic homeostasis and increase the risk of developing schizophrenia in vulnerable individuals. In the 1970s, small randomized controlled trial found that patients with schizophrenia who received a gluten-free diet intervention, in addition to standard of care inpatient psychiatric management, stabilized and discharged faster than blinded counterparts without a gluten-free diet. Going on here, the clinical antipsychotic trials for intervention effectiveness first assessed these biomarkers and found anti-gluten antibodies, this is what I was talking about earlier, including anti-tissue transglutaminase and anti-gliadin antibodies, 50 times more likely to be pathologically elevated in subjects with schizophrenia, 50 times more likely. Recently published case reports in small randomized controlled trials are utilizing these findings to study gluten-free diet interventions in patients with schizophrenia and with known anti-gliadin antibodies. Preliminary findings suggest improvement in positive symptoms, negative symptoms, extrapyramidal symptoms, attention, and gastrointestinal discomfort in patients on a gluten-free diet. Extrapyramidal, by the way, these are the symptoms of tremor and loss of balance and coordination. Think of a patient who's got Parkinson's disease. You know, most of us know a person in the White House who probably has this illness and nobody's really wanting to talk about it, but where they lose their ability to walk properly, they're shuffling their feet because their balance is off and their postural muscles start to fold forward because they can't maintain. Those are called extrapyramidal symptoms. Again, all of these things improving with gluten-free diets in clinical randomized controlled trials. So I know schizophrenia is not the same thing as anxiety, but what I want to show you is the connection between gluten causing neurological problems, and anxiety can be a manifestation, right? Anxiety, not everybody develops full-blown schizophrenia. There are levels. It's kind of like a dimmer switch on a light. The light can be turned down really low, it can be turned up a little, it can be turned up a little higher, and it can be turned on full blast. And so we could think of anxiety much in the same way. For some people, gluten exposure can cause a little bit of anxiety. For others, it can cause a lot of anxiety, and for others, it can lead them to schizophrenic delusions and behaviors. And if we don't recognize diet as an important role in this, we're never going to solve the problem, and we're only going to continue to rely on pharmaceutical drugs that don't have any meaningful outcomes in people with these diseases long term. Okay, that's all the chemical factors associated with anxiety. So I'm going to kind of switch gears here onto some of the physical factors that also, because there are other things beyond diet that are important to understand as it relates to anxiety. And one of those has to do with lack of sunshine. And this is becoming more and more of a problem as our workforce turns to indoor environments to get work done. We've done several shows on the benefits of light as therapy, and one of the benefits of sunshine is that it regulates stress hormones like cortisol. Well, this is stress hormone. It helps you cope and adapt to stress. When you don't get adequate sunshine and your cortisol levels start to drop, what ultimately can happen is this can increase anxiety. Sunlight is powerful medicine. That's why doctors prior 1950 used to prescribe sunshine, and hospitals used to be built with solariums. They were places in a hospital where patients would go to absorb the sun, to soak the sun up, as a therapy, as a treatment. So sunshine is super important. The other thing that we know that sun does is it increases ATP, or energy production, in your mitochondria. So this can accelerate the ability to help people heal. And so very, very important. So there are other effects of sunshine, but point being, you should be getting it. Program this into your lifestyle, like your life depends on it, because it does. Disruptive sleep. Well, lack of sunshine will disrupt sleep. Lack of a lot of the nutrients we were talking about earlier, like iron deficiency, B12 deficiency, magnesium deficiency, will also disrupt sleep. Not getting adequate sleep causes oxidative stress and damage in the brain, and that can also contribute to anxiety formation. We know that lack of physical activity, this is really especially true in type A personalities. People that need more exercise generally are people that are really high strung. Think of it like dogs. You know, if you look at like Alaskan Malamute breeds, those dogs will run circles around you all day long. They're such high energy dogs. If you don't exercise them well, they'll rip your pillows and your couch apart in your house. That's anxiety. That's dog anxiety. Humans can be the same way. So if you are a type A, know that you should be really focusing on, I mean, everybody should be getting physical activity, but you type A's really need it a lot more than other types. And this is also especially true in men. Men generally will develop more anxiety with less physical activity. Men are programmed for more physical activity. We need it as part of our overall health profile. So guys, get off the couch, get out of the video games, get your head out of the computers, and get out and make this part of your day on a regular daily basis. And then, of course, there can be other health issues. There are a number of other conditions, medical conditions, a lot of them related to diet and lifestyle as well, but heart disease and diabetes and autoimmune conditions, all of these can contribute to increases in anxiety. Why? Because when you are sick, you are worried. Right? Illness leads to worry, because you're worried about your health. And really where this can really escalate, and I want to point this out because I see this so frequently. So illness leads to worry. That worry translates into a trip to your doctor's office. The trip to the doctor's office, usually that conversation is, we don't know what's wrong with you because your blood work is normal. Therefore, you're just too stressed. So you get a diagnosis of being too stressed. So you get told You get gaslighted and you get told you need to relax. What is that? So sometimes you'll even get a prescription for an anti-anxiolytic medication or an antidepressant, because sometimes they call it stress and sometimes they call it you're just depressed. And that's the answer, right? And so then if you're the patient, you have this illness that caused you to worry, that made you want to go to the doctor. You didn't want to go to the doctor to waste your time because you made the illness up in your mind psychologically. You went to the doctor because you're really trying to understand why you have that illness. The doctor gaslights you and says, no, you're just stressed or depressed, here's a drug. They give you a prescription. The prescription doesn't really do much, and so you're still worried. And so your worry becomes circular, and it becomes the thing that is now feeding the very illness that you had in the first place. So the worry didn't cause the illness, but it allowed it to persist at a greater level, because when people are sick and they don't know why, they're seeking answers. Their mind is seeking to try to find a solution. And when the brightest minds, or the people we credit for being the brightest minds, are the doctors, the very doctors that gaslight us into saying, no, it's in your head, then there is no solution. And so the stress can eat you alive. Now multiply that over 10 years or 15 or 20 years, you're not going to get anywhere unless you start addressing that the reality of your health issue is not because you're anxious, but the reality of your health issue is because you're not doing things to be healthy. And the side effect or the consequence of that is anxiety, which leads to worry and doctor's visits and a never-ending cycle. So you've got to break that cycle. Then we have mental factors. So those were physical factors. These are mental factors. One of the biggest mental factors, in my opinion, today is this right here, social media. Social media has really, we talk about how it's improved life, and in some ways it has, but in many ways what social media has done is it's allowed people to be aggressive, excuse my language, it's allowed people to be assholes without social consequence. And so you get a lot of angst and anxiety and driving anger in social media, where people, if you say something that not everyone believes, but some people believe, then the people that don't believe you will come and attack you and make you feel like you're a horrid person, and vice versa. And so it drives a lot of that. If you're a young adolescent, to me, adolescents, we should ban social media for anyone under the age of 18, because kids can be tremendously hurtful to each other on these social media platforms, and that can create a ton of anxiety. And we see this playing out in the psychiatric literature. There have been numerous research studies on the social media driving more anxiety in adolescents. We also know that there's been a lot of misinformation and mass panic of late that has led to people being more fearful of being alive today. And so without getting too much into the details, I'm sure you are a discerning, intelligent audience. You can read between the lines. There's hopelessness. A lot of people are at these points of hopelessness, and there are a lot of reasons why that can be, but going back to some of the physical factors where if you have health issues and you've been circling to this doctor or these multiple doctors and nobody's helping you, you get to a point mentally where you're here, and that's a terrible place to be. And how do you break free of that? You have to find real solutions and real answers. Hopelessness is a consequence of patterns of behavior in your life or patterns of exposure in your life. So figure out what patterns preceded this sensation and backtrack it. Then we have just general confusion. What does that really mean? I can tell you one thing. So I can tell you, for example, that diet is critical to mental health. And I'm not the only one. I'm telling you that today, but there are thousands of other doctors and researchers that will tell you the same thing. And then on the other side over here, you will have this other group of doctors telling you diet has nothing to do with mental health. And so, this is polar opposites, right? You got diet has something to do with mental health. No, diet has nothing to do with mental health. Well, that's general confusion, Because how can two experts have completely polar opposite commentaries on something? And so I don't know whether that's planned, whether that's purposeful or not, but I would say, as a general rule of thumb, if you find yourself generally confused, evaluate this phrase and evaluate this phrase critically with your own heart. Like, where does your gut take you? Where does your heart take you to believe? Does diet have nothing to do with how your brain will function and how your body will function? Or does diet have everything to do with how it will have the capacity to function? So if you have somebody over here saying this, ask them to present you with the same level of evidence that I've presented with you or for you today on this side of the equation. They can't do it. So there's a lot of general confusion. I'm just giving you this as an example. There's general confusion about a lot of different things. Probably one of the best books I could encourage anyone to go and read about the general confusion of the world as we know it today is a really good book written a number of years ago called Kicking Sacred Cows. Because much of the beliefs that are held by major institutions, schools, governments, politics, etc., those beliefs are so entrenched in, we'll just say, an undue influence. And so finding the truth can be very difficult. When one person stands to lose everything they own and their business by lying to you versus not lying to you, then we get false belief patterns that exist. And so this book does a really good job talking about a lot of things in the world that are very confusing and simplifying that into its final common, or to its smallest common denominator. And then the last element here is lack of faith. We have a huge and tremendous lack of spiritual faith, especially when we look back historically. When we look at what made society as great as it is today, I think we could make great arguments that faith created a very safe environment for people to thrive and grow in and be heard in. And with that disruption, with faith being under attack, we've seen this a lot in the last few years as well. When you don't have principles, when you don't stand behind principled thinking, because principled thinking is a part of what faith is, that you cannot separate one from the other, then you end up with confusion. And this is, again, a lack of faith generally generates a lot of confusion. And I won't get too political in this conversation, but I'm sure, again, those of you watching are discerning and could probably think of a few really great examples of where lack of faith has led to a tremendous amount of confusion in our society today, especially in our young children's in their sexuality. But enough being said about that. So let's move on from that to what are some strategies? What are the solutions that we can implement for reducing anxiety? Well, a lot of the solutions we've already talked about. So in summary, sunshine, getting it every day, making sure you're getting it. Don't be scared of the sun. We've heard the message. This is kind of another one of those bipolar messages. Stay out of the sun, it causes cancer. But no, you need sun or your health will deteriorate. Well, which is it? Well, get sunshine. Just don't be ignorant about the way you get sunshine. Don't go out and burn yourself on a regular basis, but get out daily and get some sunshine. Clean food, air, and water. These are critical to human health. And as we've broken down today, clean food plays a major role in providing vitamins, minerals, and nutrients, and not providing things like gluten that create potential for anxiety. Then we have exercise, as we mentioned before, with prayer and meditation, so going back to spirituality, and then social connection. And I don't mean social media connection, I mean real social connection. When's the last time you had a face-to-face conversation with somebody you cared about or loved? Connect with the people around you. Be connected. We see this a lot today where families are at home, they're all in the same room, and everybody's on a damn personal device. Everybody's looking down at a screen instead of engaging with each other. These social engagements and connections are very, very important to your health and to your mental sanity. And then deep breathing. When all else fails, stop and get some oxygen. O2, it's everywhere. It's all around you. Breathe it in. Sometimes that's what's necessary to slow down the heart, to calm the mind, to calm the muscles. So apply these 6 fundamentals. on a daily basis. It'll go a long way to helping you reduce any anxiety you might be feeling. Look, if you found this show helpful, do me a favor. Hit that like button below, and if you're not already, hit that subscribe button. Thanks so much for tuning in to Dr. Osborne's Zone. Thanks for tuning in to the Dr. Osborne Zone. Don't forget to share, like, and subscribe for more content like this, and make sure you come back next Tuesday at 6 p.m. Central Standard Time and Thursday at noon 30 for more episodes.